Hello, my name is Herbert Schreiber. I'm presenting preliminary results of the RETRO PPMS trial. This is a retrospective study investigating best supportive and medical care in the clinical practice in patients with primary progressive multiple sclerosis in Germany. These are the disclosures of the group. The primary objective of the study is to generate representative BSC data from these patients by retrospective chart analysis. Our secondary objectives focus on data concerning off-label treatment with DMTs or cortisone. Moreover, we want to gather data on the disease course, such as disease activity with respect to disability, mobility, and clinical global impression as reported by the physician. Then we want to get insight into diagnostic issues such as first PPMS symptoms and time of diagnosis. And fourth, we want to gather data on chronic comorbidities including psychiatric disorder and adverse events. Now let's come to the results. The core analysis population, as indicated here, is comprising at the moment 99 patients with full charts. Interestingly, the time from first MS symptoms to study start was 11.8 years as compared to the time from PPMS diagnosis to study start being at 7.8 years. This means a considerable delay of 4 years. When looking at the symptom spectrum of PPMS, among the most frequent first symptoms ranked gait disturbance. This is the dominant symptom represented in the dark bar on top. Second ranked sensory problems and then muscle spasticity. In the course of the disease, the most frequent PPMS symptoms overall was muscle spasticity, followed by gait disturbance, bladder disorder, and ataxia. Interestingly, cognitive disorder and fatigue ranked low in the beginning of the disease and gained importance in the course of time, as you see on the right side. About 2/3 of patients, around 68%, received physical and/or occupational therapy in the last 27 months before study start. And interesting also, psychotherapy was used by 5% of the patients. The most common medications used by the PPMS patients were famotidine and baclofen as antispastic drugs, followed by pregabalin, cannabinoids, dronabinol, and gabapentin. This stresses the importance of neuropathic treatment in the PPMS patients. The most common symptom that was treated by drugs or other measures was muscle spasticity, as indicated on the slide by the blue and the dark bars. It was interesting to see that the majority of patients received off-label treatment. Overall, about 66% of patients received one or more off-label treatments, including 45% that had received corticosteroids and 8% that had received interferon beta 1a that was approved at that time for the secondary progressive MS only. In conclusion, we can say that the interim results of the RETRO PPMS reflect the urgent medical need prior to the availability of the first approved DMT for PPMS. This study will provide valuable real-world data about the epidemiology and individual patterns of care of patients with PPMS in Germany prior to the era of B-cell targeted therapy. Final results are expected in 2022, and they will include pre-specified group and subgroup analysis and data on pharmacoeconomics and disease activity. Thank you for your attention.